My name is Tom Hendricks. I am a physical therapist, and I've been doing this for 20 years. My dad was a professor of medicine and veterinary medicine at UC Davis. My mother is a retired librarian and travel agent. My father was one of 12 children. He was the 10th, and he was the first one to go to college. And he got that opportunity through a football scholarship, which he turned into a PhD. So he was passionate about all of us children getting a college education. He had no preference of what we chose to study or what we chose to do as a profession, but it was pretty well known that you were going to go to college. My high school experience was a good one. So as a high school athlete, I had a good time on campus. I knew a lot of people from the various sports that I played. So it was a pleasant social experience. I feel very fortunate that I had good teachers, even in junior high, that made me realize, I had certain academic strengths. I had to work hard, but I could do well in school. And so that allowed me to know kind of deep inside, I could achieve what I wanted to achieve. Socially, you get mixed up with that. Sometimes you want to spend more time with your friends. So I worked hard to balance my life so I could, have fun socially, work hard in academics, and also complete the sports that I wanted to complete. I was like above average student in high school. I wasn't, the brightest in the class. I think I worked just hard enough to, to get solid B pluses, a few A's. I probably could have worked harder, looking back. But for me, that came pretty naturally. If I worked hard, I could get a B plus or an A. I was never a natural at English or literature. Was always drawn to the sciences due to, my genuine interest in that world. So I always had to work a little harder in the non-scientific classes. When I wasn't in class in high school, I spent a lot of time with my friends. I had a really good friend who was an auto mechanic, and I used to just, love watching him, perform his craft. I liked to spend a lot of time in the weight room, kind of year-round, preparing for the sports that I participated in. Through some hardships, I learned what I wanted to do for a living. I had a great opportunity through a couple injuries and surgeries and going through physical therapy. The light bulb went on. I want to be a physical therapist or an orthopedic surgeon. And, as it turned out, I became a physical therapist. I went to college because I wanted to, and it was step number one, to the career path that I wanted to complete. I chose my college mostly due to an agreement that I had with my father. The fifth and youngest child, two of my oldest sisters had already completed college, and two were still enrolled in college. And so it was a benefit to all of us for me to stay close to home. Benefit to him financially and a benefit to me because I got a car out of the deal. My parents financed college for me. They worked very hard to provide an education, so that was not a responsibility that I needed to, burden myself. In college, I studied pre-physical therapy kinesiology. Upon graduation, I had acceptance into physical therapy school. So at completion of physical therapy school, I took and passed the state board exam and immediately had a job as a physical therapist. To be a physical therapist, you have to complete an accredited physical therapy program. 20 years ago when I went to school, that was a master's degree in physical therapy. The modern equivalent is a doctorate in physical therapy. So upon completion of the program and passing of the state board exam, you are a physical therapist. My bachelor's degree was in pre-physical therapy kinesiology. Most applicants to physical therapy school have a science background. But there's others that studied accounting or philosophy or something like that. So then they have to do a little bit more education and complete a variety of classes, a minimum requirement of science classes to be accepted into the graduate physical therapy program. I think an ideal candidate for physical therapy school has completed the scientific courses required with above average grades. They also want to see a well-rounded student. They like to have multiple experiences, in the world of physical therapy. So for myself, I volunteered in an outpatient physical therapy practice. I volunteered in a hospital. They're looking for a variety of experiences, not only in the world of physical therapy, but in other parts of medicine, because they want to make sure that you've chosen physical therapy as a career, a lifelong, passion, and you're not going to shift gears, midway through a graduate program thinking you want to be a dentist or a nurse or a PA or something in lieu of being a physical therapist. In addition, I think schools, they do require letters of recommendation. They require a personal statement of why you want to be a physical therapist. And so I think the more well-rounded you are in your experiences in the world of medicine, even in the world of life. I know there was a number of people that I went to school with that were older than the typical applicant, but they had great lifetime experiences academically and non-academically that I think made them an ideal candidate to be a great physical therapist. I think my work experience differentiated me from the pack, just enough. I think most people have experience in more than one physical therapy setting. And I think that's more or less the minimum requirement. So if you have some life experiences, or if you have more than 2 experiences in the physical therapy setting or other medical settings, I think that's going to set you apart. I knew after speaking with many people in the physical therapy profession that I needed to get experience in that profession as an entry-level student. So I embarked on a journey to, to complete that experience. And it started in a more traditional way at being a physical therapy aide in a local physical therapy practice. And as I, went through college, I had many opportunities to do things that were related to medicine, but not necessarily physical therapy. So my experiences were varied. I had a great opportunity to actually work as an autopsy assistant. So I saw, the highs and lows of life, of course, there, and that gave me great anatomical perspective on the tolerances of the human body. And I also volunteered in a orthotics and prosthetics laboratory, and I worked at a hospital as a volunteer. So that included everything from running charts and filing charts to seeing surgeries from afar, working with different medical professionals up close and firsthand. So I think the more that you can diversify, the better the chances that you'll gain acceptance into a graduate program. I think my path to becoming a physical therapist was fairly conventional. I completed my college education. I got accepted into physical therapy school right away. There was the choice of waiting to go to a more prestigious school or getting into a school that was close and ready 6 months earlier. So I chose to start earlier than, versus taking a more established graduate program. And I think, working as a coroner's assistant was a little unconventional, and maybe maybe it helped me a lot. Maybe it didn't. Once you meet the requirements for a physical therapy license, getting a job is the easy part. You won't have to knock on a bunch of doors or send out 500 resumes. It's more of just finding the right match between what you're looking for and what the employer is looking for. I think the biggest struggle for me on the road to becoming a physical therapist was, there's some really difficult classes, physics, organic chemistry, and there's times when you take those classes that you're looking at a C, C+, and you have to just, you got to dig deep and go, okay, if I want to be a physical therapist, I got to put in the hours, I got to go talk to the professor, I got to get into a study group, I got to get through this with a high B or an A to have a good shot in physical therapy. So there's some times that you have to buckle down and sacrifice, to make it happen. But I can tell you, sitting here, it's worth it. I help people recover from a myriad of different problems and dysfunctions, from car accidents, sports-related injuries, trips and falls, lifting suitcases, walking the dog. People can get hurt doing just about anything, and we help them get back to doing what they really love. And that might be sports, it might be, being able to hold and lift their child, it might mean driving. There's just everybody has a different goal, and we help them reach those goals. As an orthopedic physical therapist, I typically work on musculoskeletal type dysfunction. So that might be sciatica, somebody that has pain in the leg and the back, they feel weakness, they have a shooting pain that's going down their leg. So we treat them for those symptoms and help them recover. A high school pitcher might have tendonitis in the shoulder, and we would teach the athlete how to throw with reduced stress on the arm, improve the mechanics of the throw, decrease the inflammation. So not only are we treating the athlete, but we're preventing another injury. Golfer's elbow, tennis elbow, things that occur from just repetition. It's not so much that a trauma occurred, it's just that they did too much of something that they love. I had a high school water polo player just recently who was really on the verge of not being able to play due to severe shoulder pain. She was a collegiate potential athlete, scholarship athlete, who was really pretty bummed out, that she couldn't play to the intensity that she wanted to play. And quite honestly, she thought she may not play again. So she came in a bad place. Couldn't raise her arm or hand really over her shoulder without some kind of pain. Not quite sure how she was playing water polo. So we reduced the inflammation in her shoulder, helped her regain the strength that she needed to play. And more importantly, we educated her on the process of how to care for her shoulder pre-season, in season, and beyond the shoulder even, training the core and, training how to throw the ball properly so she would avoid such a future injury. And the good news is that she did eventually get a full ride scholarship to the college of her choice. One of my patients, who's a self-employed business owner in the cleaning business, who's just a fitness fanatic. I mean, works out probably twice a day, 3 hours a day, was in a severe car accident and had been to multiple, physicians, kind of with chasing the pain, as we like to say. And one doctor finally said, have you tried physical therapy? And she was a little hesitant to come in. She kind of pictured physical therapy being for old people and, people that were, of a much lower level of fitness than she was. But we allowed her to, physical therapy allowed her to get back to where she was. It was a slow process. She had lots of soft tissue injuries. And through the process of therapeutic exercise and some mechanics training and ergonomics training and how to sit in her car properly, all reduced, the stress of her injuries significantly. And she was able to go back to, working out. And I spend the majority of my day with patients, probably at least 80%. I spend maybe 10 or 15% of my day with my staff planning, a little bit extra time with vendors or additional, administrative duties. My daily interactions are with a mixed group of people. One of the things I love about my job is I get to meet people from all walks of life. Professionals, young, old, athletes. I also have the opportunity to work with, some of the great brains in the orthopedic industry, orthopedic surgeons, orthopedic inventors, pioneers in surgical techniques. My physical therapy practice is about 2,500 square feet. We're in a business park in Newport Beach, California. So we're on the first level. We have a small lobby upon entrance. Reception to greet you and take care of the basic appointment staff. We have 5 private treatment rooms, so I spend quite a bit of my time treating one patient after another. I have physical therapy assistants and other staff that helps me complete the process of educating and exercising the patients and using a variety of modalities to reduce pain and inflammation. We have a small but efficient gym space so people can exercise with supervision. We also utilize Pilates. Physical therapy is a good fit for me because I like to take care of people. And although people are here for orthopedic type injuries, they need a little TLC just like everybody else. So sometimes, making them work a little harder from a psychology standpoint is really what makes them better. It's not so much just the physical therapy. I am a good listener. My professors taught me, listen to your patients. They'll tell you what's wrong. I do think scientifically. You have to be able to motivate and patients through what is often one of the hardest things that they'll ever go through in their life, maybe a surgery or an accident. You have to be able to use your hands in a positive way so you can progress them but not hurt them. The best part of my day as a physical therapist is when somebody walks in and says, I'm getting better. Because often, rehab and recovery is not a straight linear progression. There's plateaus, there's disappointments, there's pain, there's setbacks. And so when they come in and they can see the light at the end of the tunnel and they know they're going to be better soon, that really makes your day a good one. The few drawbacks of a physical therapy profession are it's very physically demanding, and there's multiple arenas that you can work in, but most of them involve some physical, repetitious risk, if you will. The second one is keeping up with the demands of reimbursement for your services. Third, probably just, you're responsible for people's well-being, and that's always kind of sitting in the back of your head that, when they're done with therapy, you want them to be as good as possible. I think the characteristics that allow me to be a successful physical therapist are, being a good listener. My professors taught me to listen to your patients. They'll tell you what's wrong. I have a scientific mind, so I try to apply the principles of science and what we call evidence-based practice, to the art of physical therapy. And you have to be willing to use your hands to allow people to progress through their rehab, but not hurt them at the same time. I measure my success in at least 3 ways. Stability, meaning I have a constant flow of patients. My business is busy enough that I'm not worried about the bank account. Flexibility, I'm able to have a certain amount of time with my family and my kids and enjoy myself outside of the practice. And reputation, within the referring community, the physicians are happy with my my work and the success of their patients as well, and just the number of referrals that I get from previous patients. That means that we're, myself and my staff, we're doing the right thing. We're doing good work. The world of physical therapy is changing as we speak. More and more states have direct access, which means patients can come directly to a physical therapist for a certain amount of care prior to seeing a physician. And the level of education has moved from a master's degree to a doctorate degree. Formerly, graduates of physical therapy programs were granted a master's in physical therapy degree. Presently, almost every program in the country is now a doctorate in physical therapy degree. And the change is 2 to 6 months of additional education as part of that graduate program. And it also allows the physical therapy community to have higher educated entry-level physical therapists. The combination of direct access, which essentially means easier access for patients to get physical therapy treatment, and higher educated entry-level physical therapists, and higher educated, entry-level physical therapists allows more opportunities for the physical therapist and allows more opportunities for physical therapists to be involved in the rehabilitation of patients. These changes are great for the profession. It allows more immediate access to physical therapy services for the patients that need them, and it allows the physical therapist to have a stronger relationship with the physicians that refer patients to us. My advice for somebody that wants to be a physical therapist is to get work experience. Get practical, hands-on experience in a local clinic, a local hospital, or some other setting that physical therapy is performed every day. And along the way, gather some letters of recommendation, and continue with the academic progress, and make sure that physical therapy is right for you. What motivates me to be a physical therapist is just that thank you. When somebody thanks you and gives you the big handshake of, we helped them through a really difficult time in their life. That's why you wake up every morning and you rush to the office early and you work hard all day, because you have a positive impact on a lot of people, and that keeps me ticking. Physical therapists have a great combination of salary and flexibility. We make a good, honest living. We're not tied to our work 24 hours a day. We work hard when we're at the office, and pretty much when you're done, you rest up and you get ready for the next day. We're not on email 24 hours a day, and we have great flexibility. So if you're an athlete, you can run. If you're a reader, you can read. It's a good balance between work and play.